Welcome to the Craven County COVID 19 briefing, Friday, March 13th, 2020 at 4 p.m. We are here in the Craven County Board of Commissioners meeting room. We'll begin with Chairman Tom Mark.
Good afternoon. I'm Tom Mark, Chairman of the Craven County Board of Commissioners. Craven County has established a Craven County COVID-19 Preparedness and Response Team as part of the county's effort to prepare for the novel COVID-19. The team is made up of key departments including Public Health, Department of Social Service, Craven Area Rural Transit System, CARTS, Emergency Management, Sheriff's Office, Administration, Human Resources, Public Information, Economic Development, and Senior Center Maintenance. The team meets regularly to examine all aspects of county government and the services it provides to citizens to ensure preparedness to COVID-19. Steps are being taken to promote the health and well-being of Craven County residents and employees by examining how services are currently provided and identifying areas where extra prevention measures can be taken if needed. Craven County goal is to continue all services as long as they are in the best interest of the health and safety of our citizens. Craven County has been and will continue to work closely with external partners such as the State of North Carolina Department of Health, Human Services, North Carolina Emergency Management, Craven County Schools, City of New Bern, City of Havelock, and other municipalities in Craven County. Carolina East Hospital, and Coastal Carolina Regional Airport. North Carolina Governor Ray Cooper declared a state of emergency related to COVID-19 on March 10th, 2020, which advocates the State Emergency Operations Center. This declaration makes it easy for local agencies to coordinate and respond to COVID-19. Craven County Emergency Management is maintaining a situational awareness by closely monitoring and updating guidelines from the North Carolina Emergency Management State Emergency Operations Center. Efforts through the Web EOC system and the North Carolina Division of Public Health. Craven County Emergency Management is actively participating in implementing the new emergency medical services protocols that went into effect last week. Craven County Emergency Management has also implemented emergency medical dispatch protocols to screen 911 medical calls to aid emergency medical services response, and they are participating in all conference calls with the State of North Carolina Emergency Management. Scott Harrelson, Craven County Health Director, is here to provide you with a brief Health Department preparedness and response.
Thank you, Commissioner Mark. And I want to start by saying I know that there's been a ton of media coverage on coronavirus and that people are concerned, and we have some rumors that I've been aware of here the last few days. I did want to start out by saying that today there are no confirmed cases in Craven County. And there's actually a map, an interactive map on the DPH website of North Carolina, and you can see cases shaded at the county level and what's going on across the state. Now, another thing I wanted to reiterate is that the public health system in North Carolina has some of the brightest minds I've ever met with, physician epidemiologists on staff. They work in concert with the CDC, and then they develop guidance, and the guidance changes daily and as the situation progresses. And then they pass it along to the local health departments, and then we implement the guidance along with other partners in the area. And we have been working with Carolina East, the hospital, our EPI partners locally with the schools and Cherry Point Military Base, and just basically all of our government partners. And we've also been in contact with the local medical community and leaders in the different sectors there, as well as passing along information to all of the senior service convalescent care, rest homes, and trying to get the latest guidance out to them. They may be receiving it in other ways. We put a little bit of local information on and pass along the information just to make sure they get it. Now, I did say we didn't have any cases or confirmed cases in Craven County, but we have followed the CDC protocol, and we have had people in quarantine. And the difference between isolation and quarantine is if you're in isolation, you're symptomatic, and that's going to be the individual that's in one area of the house, hopefully, preferably using one restroom. If you're in quarantine, you're a close contact. Now, we do know that coronavirus is basically easier spread than seasonal flu, so we anticipate that close contacts may become symptomatic, so we quarantine them. And 14-day quarantine. From initial exposure, it's usually between 5 and 6 days before symptoms appear. And it is possible with this virus, as you know, or probably have heard through the media, that it's possible to shed the virus before you become symptomatic, which may be one of the reasons this has a little easier spread than seasonal flu. Now, so far, we have submitted 3 tests through the health department, and one has come back negative. We're waiting on the other 2. The symptoms are fever, cough, and shortness of breath. So initially, there was, if you were symptomatic and you had a positive travel history to one of the at-risk countries. Now, most of Europe is as what they call a Class 3 travel designation. Initially, it was Italy and South Korea and mainland China and those countries. Now, you also could be tested if you had contact with a coronavirus patient and you were symptomatic. That has changed. The bar has been lowered a bit. Now, if you are symptomatic and you have a negative flu test, rapid flu test right there at your physician's office, primary care office, then you can be tested for coronavirus. If somebody thinks that they want to attempt to be tested for coronavirus, I would caution you to please call your primary care provider, your doctor, or we have a lot of patients at the health department as well, and let them know what's going on, because they do not want to contaminate their facilities. A lot of them have already established methods for how they would like to test people with influenza-like illness. Now, I also want to remind everybody, this is allergy season. We still have seasonal flu in the area. We know that have been tested and confirmed. And there's also another upper respiratory condition that's floating around locally that is neither seasonal flu or coronavirus. So if you have some of these symptoms, it doesn't necessarily mean it's coronavirus. It may be. And if it is, we definitely want to know about it. So let's talk about transmission. It's still droplet spread. So what we want everybody to do is to try to avoid being coughed or sneezed on. And if you're the one that is coughing and sneezing, try to keep your hands away from the cough and the sneeze in your sleeve, or if somebody is in our waiting room coughing and sneezing, we ask them to put a surgical mask on. So that's what you may see people wearing surgical masks for. So that droplet spread. Also, contact surfaces and washing the hands and disinfecting the surfaces, because we know that initially they said outside of 9 days the virus could live on surfaces. Now some more data has been collected, and they're saying more like maybe up to 3 days. So if you're disinfecting and you're washing your hands and not putting your hands to your face, people have to be cognizant and aware of that shopping cart handle, that door handle on the restroom, the faucet handles, things that a lot of people touch throughout the day. Be cognizant, sanitize those hands. Now, if you do happen to contract coronavirus, I want to also remind everybody that 80% of the cases are mild. And really, the at-risk population or high-risk population are those 65 and older that have, and also those that have heart disease, lung disease, and diabetes. So with that, I'll close my comments and turn it over to Sheriff Chip Hughes. Thank you.
So first of all, I want to say to the citizens of this great county that we're very fortunate and blessed to have our elected officials, a county manager that has jumped on this thing. They have done their due diligence. And as a citizen and the elected sheriff, I feel very fortunate to work side by side because these folks do know what they're doing, and our citizens' best interest is at their heart. So, having said that, I want to reassure our citizens that the Craven County Sheriff's Office is working with our healthcare partners and county officials to address this issue. My command staff is meeting daily to monitor up-to-date information so that we can continue a proactive response in our daily operations. In addition to following common sense and universal precautions, deputies at times will handle calls by telephone just to avoid any exposures that we don't have to have. Our jail medical screening will be enhanced in an effort to reduce possible exposures as well. Otherwise, our service to the community will continue as normal, and we will advise the public of any changes via social media and public service announcements like this one. While there's a great deal of information and misinformation being shared on social media, I encourage the public to follow recommendations of their health care providers and trusted public information sources. I want to stress that the actions being taken are intended as precautions to help limit the spread of the virus. While there will be more cases, we can help limit that by the number of following these precautions that you've heard of today. So once again, reiterating, your county officials, your county manager, myself, my office, the health department are working diligently around the clock and are doing a phenomenal job. And I cannot thank them enough for their due diligence and allowing me to work side by side with them to take on this, this pandemic. Thank you.
Thank you, Sheriff Hughes. The best way to reduce your risk of becoming infected with a respiratory virus, as our health director has already said to us, and we've heard it many times over the last few days, but I just want to, for all of us to heed these recommendations, again, is to wash your hands very frequently with soap and water. Use an alcohol-based hand sanitizer, which soap and water is not available. People who are sick should always cover their coughs and sneezes. Cough in your elbow. Wash your hands after using a tissue to wipe your nose and mouth. People who are sick, and we stress this, people who are sick should stay home from work or school until they are well. And the hardest thing for all of us to do, and that is to avoid touching our eyes, nose, and our mouths with unwashed hands. Craven County citizens are encouraged to use reputable sources to learn of the information about this coronavirus. These sources of information include the Centers for Disease Control and Prevention and the North Carolina Division of Public Health websites and the North Carolina Division of Public Health coronavirus call line. And that number is 1-866-462-3821. I will say that again. The North Carolina Division of Public Health coronavirus call line is 1-866-462-3821. Craven County government COVID-19 updates will appear on the Craven County website at www.cravenncounty.nc.gov, on the Craven County Facebook page at Craven County, and the Craven County Twitter account at Craven County NC. Residents are also encouraged to register to receive notifications via the Craven County website and to register to receive emergency notifications via text, email, and phone calls through the Red Code emergency notification system, which we will be utilizing for the next few days and weeks ahead. This will conclude the briefing on behalf of Craven County, but we are very honored and blessed today to have with us two of our great leaders who represent us in the North Carolina House of Representatives. We're very fortunate to have them. They're here today to show their support on the state level for the citizens of Craven County, Representative Michael Speciale and Representative Keith Kidwell. And before I introduce Representative Speciale, we also want to say to you that our prayers are with you and your family during this time and we praying for your granddaughter. Representative Speciale.
Good afternoon. I too want to say thank you to the folks in Craven County, to your elected officials who have done an outstanding job. Your health department, your emergency management, your county commissioners, everybody's on the ball, everybody's ready to do what they have to do. My words will be few. All I want to basically say is that your state government, your General Assembly is ready to be there and do what needs to be done. We've got funding. We've got about $1 billion in a rainy day fund for emergencies like this. I also want to caution people that while this is very, very important, it's something keep your eyes out for. Wash your hands. Do all the things that you would normally do to try and avoid a flu. This is not the end of the world, and we don't need to run in there and empty out Walmart and everything else of all the toilet paper. I'm seeing things on Facebook. Everybody's buying cases of toilet paper. I have no idea where that's coming from or what they plan on using it for. But I did go to the local Walmart, and I did see that they're just about out of toilet paper and out of a few other staples. So I want to let everybody know that while we don't want to underestimate what's going on, we certainly want to keep everything in perspective. So let's not lose sight of the fact that this is one of many things over the years that we've had to deal with, and we will deal with it appropriately. Just know your elected officials, both federal, state, and local, are on the ball, and we're looking out for your best interests. Thank you.
Thank you and good afternoon. Keith Kidwell, Representative 79th District, which represents Beaufort and Craven counties. I want to reiterate the cleanliness aspect of this. That's the best way to prevent the COVID virus from spreading. You've heard it, you're going to continue to hear it. It's important. It's things we would think are common sense that we would be doing on a regular basis anyway. Wash your hands, wash your hands, wash your hands. Somebody earlier today in another press conference asked how long. The health director at that meeting said, say your ABCs twice. Then you can stop washing your hands each time. Use hot water, as hot as you can stand it when you do that. I want to let you know that the biggest thing that we have to deal with in this is really going to be the fear issue, the unknown. People don't like unknowns. We get scared of that type of thing. A lot of people are scared of the dark. Why? It's the unknown. And this is being scared of the dark. We don't have to do that. We need to be smart. We need to pay attention. We need to stay out of the large crowds. Most of that's happening on its own as the different events are being canceled. There was a concert that was coming up down here this weekend in New Bern. That's already been postponed. A lot of other things are being canceled, postponed to make sure we don't spread this virus. Representative Speciale and I have spent the last several days on many conference calls at the federal and state levels to make sure that our counties and our cities are appropriately prepared and informed on what they should and need to do in order to be prepared and eventually to respond to COVID-19. Dr. Murphy, our congressman, has indicated that one of the biggest issues we're going to face is if we do as Italy had done, where all of a sudden we inundate our medical system. We have got to do everything we can to prevent that. The way we do that is to prevent the spread of COVID-19. When they look at what happened in Italy, their hospitals got to the point they could no longer take in patients. They were having to tell them, sorry, we just can't help you. We don't want to have people in a mad rush, got a sniffle or a sneeze and run off to the hospital to be checked for COVID-19. That's not the situation that you would want to present yourself. If you think you've been exposed to it, the first thing you do is pick up a phone, call your primary care physician. They will advise you what you should do. They don't want you walking into their office if you do have this virus, in fact, because that'll do nothing but spread it worse. They don't want you walking into the emergency room because unless you're in very bad condition, the emergency room is not where you belong. In most cases, you just need to stay home and sleep it out, do whatever, and self-quarantine is the best thing that you can do. The state of North Carolina is well positioned and well prepared to take care of this event. We have over $1 billion in the rainy day fund that we've been able to put away, and that will be brought to bear as necessary in any situation that we need to make sure that the proper equipment, uniform, safety equipment is out there for all levels of your government. the thing that you need to know here today is that your elected officials are doing the things that they should be doing. They're doing them as they should do them. They're keeping in touch with the people that are hired by your elected officials in emergency management. The hospital staffs are all taking the appropriate steps to make sure that we can contain as much as possible, prevent as much as possible, and deal with the COVID-19 virus. Thank you very much.
I want to thank the county commissioners and our staff for all the work they have done. This concludes our meeting today. Thank you very much for coming.